Hi everyone, my name is Allison, and today the question I'll be answering is, did the World Health Organization have a good enough response to the COVID-19 pandemic? In my opinion, yes. So, starting January 12, 2020, the World Health Organization released information regarding the disease and how to prevent infection. This is extremely quick since the first reported case of COVID-19 was in the very late days of December of 2019. They also released travel advice, advising against traveling in the area to prevent the transmission and spread of the disease. About 10 days later, World Health Organization officials visited Wuhan, China, which the disease was believed to have originated. There, they discovered that the disease can, in fact, be transmitted between humans. This is really important that their trip was so soon because otherwise the World Health Organization and the general public would still have believed that this was transmitted between humans and animals and not a respiratory illness between humans. In the following weeks, still in January and February of 2020, regional World Health Organization offices began formulating their game plan. They helped regional areas such as the European Union create a response plan for the disease. The organization began tracking and tracing the spread of the disease in order to slow down transmission. This is called a research roadmap. People claim that the World Health Organization didn't do enough in the early stages of COVID. However, I believe that this is because the general public doesn't fully understand the responsibilities of the World Health Organization and the extent of what they can do to help crises like these. According to the Global Observatory, the World Health Organization, quote, does not have the authority to dictate state actions, and its main responsibility is to develop game plans and make suggestions on what nations can do, but they can't really command any nation to do anything in particular. They can only really just give advice and make suggestions. The resources the World Health Organization provided to other countries is enough to support my opinion that the response was good enough. They shipped supplies and provided healthcare training to many countries. This included things like gloves, masks, and information on how the disease worked and spread, to the best of their knowledge at the time. The organization used their strength and influence to act as a resource and information center to other nations and IGOs wanting more information about the disease. So before I end my argument, the IPI Global Observatory, when I was doing my research for this debate, had a really interesting topic that I wanted to touch on. They mentioned something called the infodemic, which is when there was a lot of misinformation being spread about the disease. So, I mean, at the time, the public was really scared, and because there was not a lot of information available to them about the disease. We didn't know how deadly it was, how many people actually had it, where in the world it was, and whether it was in our state or not. So when people get really scared like that, they turn to the news and they trust the news to give them as much information as possible. And in return, the news tries to give the public as much information as possible. However, the disease was progressing so rapidly and there was so much news and information coming about it every single day that the public wasn't as informed as the news and vice versa. So this is kind of a vicious cycle where people were trusting the news and the news was churning out as much information as possible. So this is why I think the public doesn't have a really good perception of the World Health Organization's response to the pandemic, because we were so in the dark about it for so long. And the World Health Organization, based on their title, seems like they could be doing a lot more. But in reality, they can, like I said, they can only really give us suggestions and recommendations on what nations could do, and up to the nations themselves to decide whether they're going to take their advice or not. So, to conclude my argument, I do believe that the World Health Organization's response to COVID was good enough. The organization acted swiftly within the first couple days of the first report of the disease and traveled to the origin of the illness immediately. Additionally, they coordinated responses, including healthcare information, medical equipment response kits, and immediate research to try to develop a vaccine. Thank you all for watching.